Hello, my dear doctor. I have come forward a very important things, which is life-changing decision for the doctors like Indian doctors in all over the world. Basically, when you are resided back in India, you are thinking about what to do after MBBS. After MBBS, the doctors are always look for the post-graduation exams back in India, having some highly competitive exams. And after that, you get one of the subjects, then you read them out. And maybe after 3, 4, 5 years later on, that you feel extremely frustrated because you wanted to be a medicine specialist. Medicine is such a subject, the peoples really love them. Even after 5 years, 10 years, 20 years later, then you'll feel that, oh, I should learn medicine. Yes, my dear. So medicine lovers are something like that. So I encourage everyone who loves medicine, the Indian doctors, you must do MRCP. MRCP will give you the variety of the ways of the benefits. I'll discuss in later on, but I'll talk very short video for all of you guys, for the Indian doctors, the fresh graduates, middle career, or you already have some of the postgraduate degrees, or sometimes you have frustrated, you are just tracked out by doing some non-clinical jobs, but you had an intention to do clinical degrees and to be a specialist doctors as well. So the MRCP will be a golden opportunity for the Indian doctors to keep going forward towards the career like the MRCP and doing the postgraduate degrees. Definitely it's quite difficult for the people's having the study gap or maybe the career gap or maybe the some clinical gaps. For them it's quite difficult. But for them, I'm telling you, my dear, MRCP is the best option. You can start now. And I'll guide you, I'm telling you. Or if you have any guide, just go with them. But if you're feeling that, yes, Dr. Saha, Dr. Sumanta, whatever you say, yes, Sumanta sir, you are the guide. You help me, and I will run with your hands. Definitely, I'll get the results in your life, my dear. So, career pathway for the Indian doctors, once again, MRCP journey. So I'll talk regarding to inspire, to motivate, and a very short few questions that are asked by the Indian doctors, because I have the highest number of the doctors from the India and all over the world for doing the MRCP. So that's why the people still not known the facts, the bits of information which are really important, because I had lots of programs that I did back in India, in Chennai, in Kolkata, in Hyderabad, in Bangalore, in Mumbai. So we did lots of programs since 2009. This is 2025. And I try to make the people to understand. And definitely through the social media, you must have acquainted. The SsAcademy International is running very successfully to guide, to monitor, and to deal with the lots of candidates, to make them, to build, to help them to build up their career to be an internist, means the internal medicine specialist, and definitely for the pathway to NHS career. So yes, once again, me, Dr. Saha, yes, Dr. Sumanta Kumar Saha, now currently working in NHS England as an acute medicine consultant, and I'm definitely the founder chairman, but I'm a mentor on SsAcademy, still going some of the lectures for the online. Yes, my dear, from the UK. And definitely I'm guiding everyone how to run, how to do that, and everything I'm doing, my dear. So yes, the things that I'm going to discuss, the questions you can ask, the why MRCP UK. Yes, the photo that I have taken very recently, just I had an this ceremonial program for the FORCP London from Royal College of Physicians of the United Kingdom. So I thought that this photo will encourage everyone to have this vibe, to be a prestigious and senior, call it, yes, the senior positions and having the FRCP London as well. So yes, the career is just in your hands, my dear. So once again, the question is for the junior doctors that you are thinking, why MRCP UK? So once again, this photo is very recent photo. Yes, once again, from very respected, and I'm just fan of her, Professor Dr. Mumtaz Patel. Actually, it's really difficult for me to define her. It's really difficult for me just to say few words about her. She is such a leader, and having such a leadership, and that acquired that position of the president of the Royal College of Physicians, which feels extremely very close to our heart, because she is the Southeast Asian Jones, the president, the first time president in United Kingdom from the Royal College of Physicians. So we should be proud of her, and definitely I feel extremely proud of her. And I feel that she is the president, all right. We are very close to her, and I feel I'm close to her, something like that. That's the feeling. And her approach towards every fellows and members is a different from other, definitely. I'm not comparing, but yes, she's really, really different. So yes, under her leadership, the Royal College is running very, very, very well, and definitely Royal College is having innovations with this, some beneficial effects for the trainee doctors, and making them easier access to the training them the best possible way, and definitely to make them a good physicians and to contribute to the Royal Colleges, and definitely to contribute to the NHS systems as well. So yes, the global recognition, why not do that? Definitely. And direct NHS access. So these two important is enough. And academic prestige, yes, as immense credibility and recognition in India. Definitely is recognized in India. So yes, if you get back the next question, yes. So that's really important. So this journey. So these also the recent photos. So with all the fellows we together. I'm just here, just behind her. So these are all the Royal College fellows all together. So yes, if you start with MBBS and internship, this will build strong clinical foundation. I encourage for all the Indian doctors, you should be keep yourself on a training institutions rather than a private clinic jobs during internship and post internship. And during that time, you prepare yourself the best possible the part one. You'll be great to know that we ran the course for the MRCP part one for the last 16, 17 years. It's a long journey. We have the huge number of the doctors. My own student is a fellow here. That is the most pride from myself, actually. So yes, once again, the MRCP part one, how to prepare, what study materials that you need. So one of my students gives the feedbacks. Just rely and just surrender to Sumanta sir. He will guide, he will give you everything. Just you don't need to worry about. So why not to accept it? So in the part 2 written, once again, the more diagnostic challenges, more management reasoning is really important for the part 2 written. It's more complex. So during that time, you also keep in touch with the clinical attachments, and clinical part definitely with the clinical hospital. So these 3 years, you have some of the clinical attachments or clinical jobs that you do, but apart from that, you need to prepare yourself for the focused examination preparation, because the UK exams, UK systems, NHS systems, the guidelines, protocol, recent guidelines, current guidelines, updated guidelines, data interpretations, photography, everything that you need to know, and definitely the clinically bedside diagnosis is essential, because you can't do the whole test rather than very specific tests to make the diagnosis confirmed for the PACES exam. And definitely you'll get the GMC registration after that, license to practice and NHS career. You will be posted after the MRCP as a specialty doctor, means a mid-grade doctor, which is career pathway towards the consultant. After 4, 5, 6, 7, 8 years later on, you'll be a consultant. So it's a very smooth path. It's not just like India, right, has not got the position, so the peoples are getting slower on the process of their career towards the consultant or sometimes the professorship as well. So I encourage everyone to do the MRCP because it's a golden opportunities. I don't encourage to do the country degrees like the MD, DM, DNB. You do everything. I'm telling you. But apart from that, you do the internationally recognized postgraduate qualifications, and you have the another door open, and you come back to the UK, you do train at least 4 or 5 years here, and then go back to the country if you want. Because you trained the best possible way, you learned the most methodical things, and then you work on the home country and you innovate something, you create something, you serve the people so in different ways, definitely it will impact in your clinical practice. I'm damn sure. I have some of the few rules. The 7Ps are very famous in all over the world, but yes, these 7P rules I just modified for the induction peoples, with the initial peoples, those who are thinking to do, not to do the MRCP. So the first P is the passion. Yes, fine. The passion is important. Means you should have that passion. Means you should in love. All right, just the love that you do for your girlfriend, for the boyfriend. Every time you're just listening, the message, phone calls, you're always intense. So you should love the medicine, the subject. If you love the medicine, the path will open, my dear. Itself, it will open the doors subsequently, and then you'll get the real path and the target, and you achieve your goal, my dear. So love the medicine, enjoy the journey. And second P is yes, the after the passion, then I should say this is the plan, the second plan. So planning is essential. You should have a very good planning. Well-planned peoples are the good doctors, competent doctors, and famous doctors in your country. The peoples, as much they are planned, they are more successful in their life. So a good doctor is a good planner. You should have a good planning in terms of your passing your exam, apart from your career, apart from your the job life and the family life, and apart from these two, you have this career plan doing the MRCP. So definitely, if you are coming to me, I will guide you how to make a plan, to set a plan, and this set plan will help you to to take a prescribed format of the learning, my dear. Just not to leave anything else, rather than keeping your every jobs that you're doing, currently doing. I never say to leave the jobs. I always say that you should keep the jobs the way that you're doing. So the plan is essential. Second P is the preparations, my dear. So preparations, once again, now the question, what materials, what resources that you need to go. One of my students says that just rely on the Sumanta sir, because he will provide everything. And the SS box is very famous in all over the world. So yes, every materials will be provided from here, all the questions bank, whatever you need, my dear. The persistence is the key to your success, my dear. Never stop, consistently beats failure. So because the life has got so many struggles, physical struggle, psychological struggle, economical struggle, social struggle, and so many lateral struggles that you have to face in your life. So if you have the persistency, if you are decided with the starting with the passion, plan, prepare, and persistency, you will definitely can do it, my dear. And definitely practice with the lectures that I'll provide to you. Or if you are thinking that you'll do study by yourself or from any other institutions, fine. But practice, practice, and practice, my dear. That's essential. But how to do practice? What is the method that we will provide on behalf of SsAcademy? That's tremendous, my dear. I'll tell you. And last is performance in the exam hall. And that is also some tips and tricks I'll make you to learn. So yes, the career growth in the UK. Yes, what career? You can ask that. What is the attraction in the UK NHS job? Definitely a junior doctor just passed MBBS. You can earn 55 to 70,000. It's not a matter of jokes. Just passing MBBS, you will start like that. It's a huge money, yes, in compared to the India or somewhere, right? So you'll have a car, you'll have a house within 2 years. And if you're an MRCP holder, so yes, definitely you'll have the more attractive salary, like the 70 to 90. So you can think about the 5,000, 6,000 rupees, 6 lakh rupees in a month, or 7 lakhs, 8 lakhs rupees in a month. So it's a good and smart and the standard quality of the life. If you have the quality of the life, you will provide the quality services to the patients. If you have the quality health, you will provide the quality health to your patients, my dear. So you should have ensured, essentially, your health, your economy, your family, your society first. You stabilize yourself first, then you provide the stabilizations to the peoples, right? And definitely in the consultant, after 5, 6, 7 years later on, you'll be consultant. Definitely you can earn like 12, 13, 15, 20,000 pounds in a month even. And a lot of consultants are earning a lot. So I also don't know how much they're earning. If you're working extra on the weekends, you can earn a lot, my dear. So lots of, in terms of the materialistic achievements, I'm telling you, my dear, you will have nothing to be worried about it. But apart from the materialistic achievement, the best things that you achieve, the systems, the protocols, the guidelines, because this is practiced just like a guidelines. So you will be aligned with the guidelines. So whenever you feel that you are sick to your home, so you can go back to your home and you can launch the practice, the standards of the practice. And your practice is not practice, you are supervised by the GMC, rigorously supervised. You should have an appraisal every year and then revalidation. So the trust is also supervising you. So you are supervised. That's important. So that you can always maintain the standards of the service to the patients. Key questions answer some various variety of the questions that I receive and SsAcademy is receiving. So I have just picked up few questions here. But if you have any questions, any doubts, anything else, we are helping. We have been helping since 2009, and this is 2025. So why not to help? Just knock us onto the terms, and we are happy to help you. And definitely, I'll come forward very specific questions from the Indian guidelines for the doctors. So here's the key questions are answered, the basics. Here's the part on the basics. Why choose the MRCP over the MD and DNB? You can ask the question. Globally recognized MRCP and opens direct GMC registration without PLAB. All right, no need the PLAB. How long does it take? As I said, my guidelines are 3 years for all parts. MRCP is valid in India. Yes, the question is NMC as postgraduate qualification for specialist and teaching post. Yes. What is the cost in 2025? Yes, I think 3 to 4 lakhs is fine. 3 parts, 3 to 4 lakhs, fine. It's not that expensive, I'm telling you, my dear. Yes. Can I study while working? Yes, structured hybrid courses video. Yes, definitely. I always advise that everyone keep your jobs. Don't leave the jobs. Don't leave your working place. Wherever you are, even those are non-clinical jobs. Even those are non-clinical. You just keep the jobs and do study with me, with SsAcademy. I'm telling you, I'll guide you. You need only the 2 to 3 hours study. And after part 1, even part 2 read. And after that, you do a clinical attachment with the clinical hospitals. That's enough to pass the PACES exam. Get the degrees, get the registration GMC, come back to this country, do the jobs, and try to work some of the hand jobs, some clinical skills, some procedure skills in your hands, then you will be fitted enough in the NHS, my dear. Is PACES available in India? Yes, there are many centers in India. So you can finish all the part 1, part 2 written, and the PACES in India. You get the degree in India. You don't need to come back to UK. And you'll get a job by doing just a video conference interview you'll give. You'll get the jobs. You'll get the tickets and come back with your all family members back to the UK. Start your job on the next morning. I think this is the easiest way to get a job, even than thereof in India, my dear. So why not to grab it? Why not to ensure yourself that level of job, ensure it. And then after that, you think that you can get back to your country. If you're really homesick, if you really think about your country, so yes, I always welcome. But here's the guidelines that I provide, very short, concise, and effective. Very short period of time, I say 20, 25 minutes I'll take. But that guidelines essentially will help you to decide, I'm telling you, to decide. But once again, if you have any doubts, any questions, after that, myself, SsAcademy team is always 24/7 to help you. They are just spreading their hands, they're opening their hearts to help you, to guide you, to monitor you. And definitely I'll teach you the best possible way. And you can watch the YouTube links. There are so many YouTube lectures, clinical lectures, part 1, part 2 lectures. And definitely I encourage everyone to join me on the interactive Zoom live classes every Saturday that I do conduct from the UK. And if you are not messed up with that time, not issues, you can do the online classes. And that's really helpful, my dear. I'm telling you, the best benefits, best help. The people sometimes not getting the best things in their hands, sometimes they're frustrated. But I'm telling you, I'm giving the full confidence. After having this course, you'll feel that you are really trained enough to 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 give the right answers correct with confidence with the every questions that you will encounter in the part 1, part 2 written exams and definitely the clinical exams, my dear. Is a full package of MRCP that will be provided. And last but not the least, yes, there are other questions are here. After MRC, how to move to the UK, GMC registration, NHS job, visa sponsor is easier enough. You'll be just like a honored, it's just like a king. You'll be, the king is coming to this country with these all the honors, my dear. What is the success rate? Is overall success rate is all over the world is 40 to 60%, but our success rate is 100% most of the times. But yes, sometimes the people do less, so yes, more than 85 to 90% success rate from the SsAcademy. Is there any age limit? No age limit. Yes, no age limit. Stay consistent. Final advice for the Indian doctors: use authentic resources, follow the 7P rules rigorously. And last but not the least, I'll show one thing. This is the hands. I purchased it. It's one of the showpiece, my dear. This is the hands. This is not my hands. My hands, this one. This is your hands, my dear. So everything is in your hands. Everything, I'm telling you. What I said, everything is in your hands. This is your life, your hands, your career, your target, your goal. And the way that you will activate these hands, you will get the success in your hands, my dear. I'm telling you once again. So every success in your hands. Now the decision is yours. Start the decision. Get the success in your hands, my dear. Once again, I'm more than happy from the UK. Huge experience in 17 years to guide, to monitor, to mentor the students all over the world for the MRCP students. You will get the best, my dear. Thank you. Thank you very much. I hope that you enjoyed and you got the best guidelines. So once again, I used to say the SS boxes. So start with a clear goal. Stay strong with the 7P rules. Act daily, aim high. Connect with the mentors and hold on to hope, my dear. So that's the things that you can get. Beginning your journey today, 85% success rate. Yes, if you say the 17-year journey, 85% is huge success rate. And 2 to 3 years is fine, and 140K consultant salary, peak earning potential. So many things, my dear. Yes, I hope that you enjoyed. Thank you. Thank you very much. Thank you, my dear.